Hey everyone, Dr. Alex here. In today's short video, we're gonna go over some exercises slash some stretches that you can do at home in the comfort of your own home to help with any tightness that you have in the glutes or the buttocks that might come from some sort of issue with the spine, or maybe it's simply from a hard workout. In another video, we might talk about why this might be going on, but the purpose of this video is just to help give you some relief, help give you some stretches that are gonna help. So let's do it, let's get into it. So the first stretch we're gonna do is one mainly where we're just standing. This is gonna be a standing pigeon pose. This is gonna target some of the piriformis muscle, as well as partially the gluteus maximus and maybe the upper part of the hamstring. With this, you're gonna find some sort of chair or some sort of couch, anything that's a little bit soft that you can get into this figure 4 position. Now, if you do this exercise right, it shouldn't bother your knee, or if your knee is healthy, it shouldn't bother your knee. You'll see here there's a couple of different techniques I'm using. I'm either squatting down, dropping the buttock toward the ground, not moving towards the knee, but dropping it straight down. Or in other instances, I'm more just bending forward. You can see my head tilt forward as I lean. Or in some cases, I'm doing both at the same time. I'm doing little bounces or oscillations that are really, really slow. And you can see from the side that I'm not moving too far forward over the knee. I'm trying to drop the buttocks straight down, which will help to stretch those muscles and the deep rotators underneath the gluteus maximus, especially the piriformis and the gemelli and the obturator internus, externus, etc. If this stretch bothers your knee, obviously don't do it. There'll be another one in this series that you can try. You can play around with lowering or raising up the seat if your chair allows for that, or putting a cushion on the surface you're trying to do the stretch, and you should feel this deep in the buttock or deep in the glute, and that should be a really nice stretch for most people. So next we're gonna do a stretch for the lateral glutes, the gluteus medius and minimus on the side of the hip. So with this stretch, it's really important to keep that outer leg straight, and that is going to be the leg that we lean into. We've done this stretch multiple times on the channel before, talking about how you want to shift the hip straight out to the side, but you'll also see in this modification, or some modifications, where I'll bring the hip a little bit backwards or a little bit forwards to either stretch different parts of those glutes or also somewhat the tensor fascia lata muscle. You'll see when I do this stretch, that bottom leg or the outer leg stays straight, and we bring the inner leg over, and that's gonna allow us to sink in deeper and deepen that stretch. You can see from this side angle here that the hip comes straight out to the side and that the body stays, if you can imagine, between two narrow planes of glass or in that narrow alleyway. You can also drive the glute or the buttock backwards to get some different fibers that are a little bit more posterior or backwards. Or you can also bring the hip a little bit more forward, which you can see right here, and that will get more of the flexor and the anterior fibers of the gluteus minimus and medius. Bringing that arm up and over will help to deepen that stretch. You might also get some stretch through the lat muscle and through the QL, but those are two really, really good modifications and a great stretch in general to stretch out the side of the hip and the glute muscles. This next stretch I wanted to include, it's not necessarily going to stretch the glutes, it's more predominantly for the paraspinal muscles and the quadratus lumborum, but you will stretch some of the upper glute fibers, and typically if the glutes are tight, you're also gonna have some low back tightness. With this, you can see I put my arms into that L shape, and what I'm trying to do is with the L or with the arm position, trying to demonstrate how we're bending. And you'll notice that this stretch is similar to the one we just went over where the hip comes out to the side. What the big difference is that more of the bend comes through the spine as opposed to the hip. And you'll see with this stretch that the lower arm, that's gonna move across the body, and then the upper arm is gonna move to the outside. This one's a little bit more difficult in terms of the coordination. You might need to watch the video a couple times. You should feel this stretch in the back here and a little bit off to the side as you lean forward. That lean forward is you're gonna get more of the paraspinal fibers and more QL or quadratus lumborum as you move more of that hip and spine laterally or to the outside. So if you've got more tightness on the outside, you're gonna push the hip or the spine more to the outside. And if you've got more tightness towards the back of the spine, you're gonna have to lean a little bit more forward and really reach with the arms to deepen that stretch. The last couple of stretches we're gonna do are super simple. This is just a simple knee to chest stretch, but it does the job right. Usually what I tell patients is you bring that knee straight up towards the middle of the collarbone or the breast or the nipple, right in the middle of the chest. You bring that knee as much as you can, and when you stop feeling a stretch, whether it's after 5 seconds or a minute, that's when you start to bring that knee over to the opposite shoulder. You'll notice in the video here that I'm grabbing the outer part of my leg and really yanking it or pulling it towards the opposite shoulder, and that just helps me get a better grip of the leg. And I'm also trying to pull upwards again to the opposite shoulder, and you should feel that deep in the glute or in that lower gluteus maximus, the big gluteal muscle. If you can try to keep both shoulders close to the ground, or try and keep that outer shoulder that the knee is moving away from, if you try to keep that closer to the ground, you will notice that will deepen your stretch versus just rotating the body easily over. Try to keep the upper body against the ground, bringing the knee up and over. That will get you the most stretch here. This is one of those stretches you might do for a couple minutes. Again, pulling the knee up to the same side shoulder, and when that stretch goes away, you're gonna pull it to the opposite shoulder, and that will help to stretch the gluteus maximus and maybe the piriformis a little bit as well. So if your glutes and piriformis muscle are really, really tight, this last stretch is for you. When I was doing this stretch, I didn't feel too much. I need to do that pigeon or standing pigeon in order to feel this. But you can see I get into this figure 4 position where one leg is sitting on top of the other thigh, and then you're reaching the hand through and pulling the knee towards the chest. You should have that figure 4 leg. The thigh should move towards, or be pointing towards the middle of the collarbone, trying to get as much of a 4 position as you can, or keeping that thigh as straight as you can. And on this one, the more that you pull the leg towards the chest, the deeper the stretch should be. This stretch you should feel deeper, more inside than the last one, and if you're getting that, that's going to be that piriformis and the rotators deep within the hip, below or deep to the gluteus maximus. That's how you know if you're doing it right. If this stretch feels the same as the last one we did, just the knee to the chest, then odds are you probably need to do more of that standing pigeon to get deep within the glutes and get a good stretch that way. So everyone, I hope as always that was helpful. If you give a like or a subscribe, if this video was helpful to you and you got a good stretch for your glutes out of this video. And if you have any comments, questions, concerns, please let me know. If you notice that you're doing these stretches regularly and they're not providing the relief that you think you should get, that's where you should probably consult a spine expert in your area to see if there is some sort of underlying cause or underlying problem that is causing that tightness, where the tightness is more the symptom of a problem. But if you notice that these stretches work really well, that you're functioning well and they're feeling good, then that's probably a good sign that it's just an issue of muscle tightness and the stretches are doing you well. I'm signing off, guys. Dr. Alex, take care. Be well.